Contusion, either contusion, can get contusion anywhere. Then turf toe, injury here, or injury here, ligament sprain, either here or here, second or here. Anyone you call turf toe. Okay. So next is dislocation, whether this bone dislocate, distal bone dislocate, or this in between bone dislocate, anything, or here dislocate, or here dislocation. Okay, talar, subtalar dislocation. Anyhow, and the syndesmotic dislocation is very dangerous. Okay, we have to do a syndesmotic injury. Usually syndesmotic injury is pain here. Okay, in that time you have to use 10-6. In that time, then do after 5 or 6 days completion. Okay, so here a syndesmotic injury grade 1, grade 2, grade 3. So in between the syndesmotic ligament sprain occur. The ligament which attach distal fibula, distal tibia. At that time, you have to give a compression bandage here. No need of bandage here, no need of bandage here. And you have to immobilize this joint. Yeah. It's okay, but here you have to do compression bandage after putting cotton. So our aim is to make it heal by making neutral position, because injury inside this, in between this.
There's no need of light section.
That neutral position. Neutral position. Okay. So a compression bandage first here, and we are doing compression here. Always monitor the patient. Ask the patient to 2-day visit, because we are doing a compression. So inside this all blood vessels pass through this. So chance of edema, vascular problem is more. So ask the patient to visit 2 days. So above this compression bandage, you can do your slab.
One slab.
Okay. Then after 5 or 6 days, you can do complete slab. Simple treatment. So mild as a first degree is as a base injuries. So there may be 3 type of names there. One is distal end, most distal end here. Most distal end. This is most distal end. Here that is most distal avulsion fracture due to the pull of muscles. Okay, avulsion fracture. And this apophysis, metaphysis. In that, in between that, John's fracture. That I sent you. And distal end, this proximal end bone fracture, this proximal shaft fracture is called stress fracture due to continuous march fracture. Policeman march. The continuous march causes stress fracture. Anything, if any fracture, there is no displacement, you can simply plaster it. If there is here, normally there is no displacement.
Only fracture is there.
Okay. So this is suited for this injury cast. And you are doing that any fracture here, you have to take at least up to here. This bandage. Okay, little more upside. Okay. So up to 20 centimeter or 15 centimeter have to bandage to get more strength.
Muscle stability.
Muscle stability is must. This is patient fail this area because fibulocalcaneal ligament, anterior fibulocalcaneal, posterior. Those two ligaments. Then fibulatalar ligament. Both we can get. And if it is here, maybe some fracture inside anterior talar process. Calcaneal process.
Anterior process.
Okay. So then we should be careful. You have to check X-ray. So now we are going to. We are dealing with this fracture. So you start from here. Before you just give labana. Take labana. Take labana. Here. You can do little more. Just only taking little more. So here the fracture. You can do Nagaradi and Murivana. Okay, Nagaradi Surna Murivana. Or simply this. So this is. You can do more. Round. Okay. So now it completely. This cotton neck little non-uniform, but you have to make it uniform. Okay. So here is okay. And first time I showed this finger, but now this. So you feel more difficulty in this case. So now you have to simply common sense. Okay. It is little difficult and time taking. Right? Yes. Now it's okay. Now just cut it. Okay. Now it's okay. Okay. 5, 6. Oh, just ready there. So we have to bandage it. And here we start. This is the most difficult part. This thumb is very easy. So from here we start our difficulty. Okay. So it is very difficult to simply bandage it. Next, because only compression is enough. Yeah. Patient, hello. Simply compression only. So next, yeah. Don't try to pull. Okay, just like this. Only. Yeah. Next, make it fair.
Figure of it.
Figure of it. Okay. Because if you fold and finger will like this. Okay. We are our aim is just to give compression only. Okay. Next, immobilization will give splint. We are using splint. That will give immobilization. If you pull like this, it is difficult. Okay. So it is enough. Neutral position. So we can come to one more round. Okay. And it is enough. Okay, allergy. Okay. Because this is allergen. Okay. Cotton is allergen. Scissor. 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 This is then splint. So now next this. Okay, this is splint. Now we are going to make a splint. Okay. You have to first make this arrange this. Okay. So now just like this. Okay. Now you make a splint. Now our next step is you have to make it narrow. Yeah. Okay. So this is first splint. So not that. You have to cut it. You have to prepare everything before the procedure. On the table, everything should be available. So make before that you pour murugana. You can apply murugana before applying this. And better don't pour murugana over this. It will smell. 2 days after 2 days it will become smell. So just like okay. You take 2 times. See now. Because of Nagradi Leba and Murugana, if it is not available, you can use. It is a pattern pressure. It's a good shop or Pagara. Nagradi, Churna and Murugana is classical. If it is not available, you can use. I am using, that is why I bring it. Okay. So next here also. Here available. You are listening. Now it's okay. Now one more thing. Okay. Just yeah. Contain main ingredient, a lot of ingredients.
There are two types of
Turf. It is non-displaced fracture, displaced fracture, combinatorial fracture, and fracture. Easy enough.
And sir, this leg also fracture heal perfect.
Yes. Not healing, Shopahara and Pangara. Okay, that is. Bandage should be Sir, there should be surely one severe pain, especially at bandage night. Patient go and night surely. So you can advise one day one analgesic medicine for one day. This is last
Normal.
Yeah. Stiffness is mild pieces make act as a irritant and it induce callus formation. To induce callus formation, joint stiffness. This location you have to correct.